everyone. Would you spare a few minutes of your time to learn how you can turn those few minutes into years? It's really all about a healthy lifestyle, which I know that may seem really difficult. However, one easy way that you can start is by monitoring your vital signs. It gives insight on your current state of health, and it can also be done right at home. It wasn't until I became a CNA that I really learned the importance of vital signs. They measure the basic body functions, and they also can show progress towards recovery. They can show potential diseases, and they just assess overall physical health. So in this demonstration, I'm going to show you how to take vitals, and I'm also going to show you how vital signs are important for our health. So some of you may not even know what vital signs are or what they consist of, and that's okay. Vital signs are measurements made up of temperature, blood pressure, respiration rate, and pulse rate. So body temperature typically ranges in adults from 97.9 degrees to 99.1 degrees Fahrenheit. However, the average is 98.6 degrees Fahrenheit. Thermometers can be placed in different areas such as the mouth, ears, rectum, under the armpits, forehead, to determine what that body temperature is. Blood pressure is the measurement of the pressure of blood against the arteries. It's written in two numbers like a fraction. The first number measures the pressure when your heart is beating, and the second number measures the pressure when your heart is at rest. So healthy blood pressure for an adult is 120/80, and having high blood pressure can lead to medical emergencies such as heart failure or stroke. Having low blood pressure can result in dizziness or fainting. Pulse or heart rate is the number of times your heart beats per minute. It's lower at rest and higher when active. A normal pulse for adults is 60 to 100 beats per minute. And your pulse can be measured at different areas on your body as well. But just to name a few, your neck, your wrist, and then right in where your arm bends. Respiratory rate or your breathing rate is the number of breaths you take per minute. Normal respirations in adults are 12 to 20 breaths per minute. Respirations below 12 or above 25 are considered abnormal. Okay, so I have my patient, and first we are going to start with our temperature. So I have my thermometer. I'm going to place it on the forehead. I'm going to let that calculate. Her temperature is 99.5. So I'm just going to record that on my paper, 99.5. Next, we are going to take blood pressure. So I have my stethoscope, and I have my blood pressure cuff. And I'm going to extend your arm. I'm going to adjust the cuff. Okay. And I'm going to pump the air until it is up to 180. almost there. I'm going to release. I'm going to listen for a heartbeat, the first heartbeat and the last heartbeat. Okay, I'm going to release all of that air. I'm going to remove the cuff. So the first number was 124, and the second number was 82. So I have 124 over 82. Next, I'm going to take her pulse. So I'm going to get out my stopwatch, and I'm going to time it for a minute. So I'm going to have you extend your arm again. And I'm going to place my pointer finger and my middle finger right above the area or under the area of her thumb. And I'm going to place my other thumb under her wrist. And I'm going to feel for a pulse. And when I feel for a pulse, I'm going to start my timer. And I'm going to keep track of how many times I feel her pulse beat for a minute. So I'm going to start that now. Okay, I'm going to stop. So her pulse rate was 82 beats per minute. So I'm going to record that. 82. And lastly, I'm going to check her respirations. So I'm going to watch her chest for a minute, and every time it rises and falls, that will count as one respiration. So we will count. I'm going to stop. And I got 16 breaths per minute. So I'm going to record that. And that's how I would record my vitals. Thank you for being my patient. So these measurements can be used to detect early signs of infection They discover symptomless problems, and they prevent misdiagnosis. They are very critical for our health, and seeing those numbers can encourage us to make better decisions for our lifestyle. What are your vital signs trying to tell you? If you're interested, you can always find more information on reliable websites, tutorials, or for the most accurate measurements, I would call your doctor. Thank you for taking the time to learn about how to take vitals and just how important vitals truly are to our health.